Hello, doctors. In this session, we'll cover the most important topic in grammar, which is the verb tenses. First of all, variables in English, like gerunds, infinitives, and participles. The three variables are formed from verbs, but are never used alone as action words in sentences. Instead, variables function as nouns, adjectives, or adverbs. These variables are important in phrases. Yes, doctor, please. Yes. Okay. The gerund ends in ing and functions as a noun. For example, jumping is fun. He liked skiing. He had a unique way of whistling. The infinitive is the base form of a verb with to. Usually it functions as a noun, although it can also function as adjective or adverb. For example, to jump is fun. The noun here, to jump, in the place of subject. The subject here, to jump, this is the subject, a noun, is the verb, fun here, adjective. Is I like to sky, noun, direct object, to sky, I the subject, like the main verb, to sky, he the object of the verb like. The last one, she had a suggestion to offer. To offer, this is an adjective modifying the suggestion. A participle is a verb that ends in ing, this is the present participle, or ed, d, t, en for past participle, like the third form of a verb, past participle. Participles may function as adjectives describing or modifying nouns. The dancing parrots entertained the crowd. The dancing parrots, dancing, this is a description modifying the parrots. Which parrots? The dancing one, or the dancing parrots. The rigged sailboat washed up on shore. Which sailboat? The rigged one. The first one, dancing, end with ing. This is a present participle. Adjective, present participle. While the next one, rigged, end with ed, rigged sailboat, here past participle, also adjective. But participles have another function when used with helping verbs such as to be and to have. They are action verbs and form several verb tenses, like she is thinking of the children. Thinking here again end with ing, present participle. But before this present participle, we have this helping verb or auxiliary, which is is. Is, it's a present form of verb to be. She is thinking here. The function of this word thinking like a continuous verb. So this is a verb tense. Present continuous is thinking. The conference room had been cleaned before they arrived. The conference room is the subject, the conference room. But here had been cleaned. Here we have a passive voice. So the conference room is an object, not subject. The conference room had been cleaned before they arrived. Had been cleaned. This is the passive form of had been. Had been, this is the past perfect tense, and cleaned, this is the main verb, and we will learn how to form a passive form or passive voice of an active sentence. So cleaned again here come with had. This is an auxiliary verb, the past form of verb to have. So here we have another verb tense. Briefly, the first slide and the next one, just to distinguish between the verb forms. In the first one, here we have V1, the first form of a verb, and this is the second one, and this is the third form. Present form, past participle, and VING, the gerund or the noun of this verb. Read, this is the present form. Read, this is the past form. Read again, past participle, the third form. And reading, this is the gerund or noun, reading. Write, wrote, written, writing. While the next slide, here we have an infinitive form, which is the base of any word in English, like be, this infinitive be, the present form of this infinitive word is or am or are. And past simple was and were, past participle been, and the gerund is being. This is just to know the forms of verbs or words in English. So let's start with verb tenses. Verb tenses come in three tenses and four types each. The first one, past, the second one, present, and the third one, future. Past tense, the past is used to describe things that have already happened earlier in the day, or yesterday, or last week, or 3 years ago. So here we have a time reference in the past. So actions already happened in the past. That's why this is the first tense, past. Present, the present tense is used to describe things that are happening right now or things that are continuous. So the second one, present, is the tense talking about or describing actions or events happening right now or continuous. The last one, future. The future tense describes things that have yet to happen, like later, tomorrow, next week, next year, 3 years from now. Actions will happen in the future. This is the most important slide in our session today. Just know that regarding the verb tenses, simple, the auxiliary for simple is do, verb to do, and for continuous tenses, the auxiliary verb to be, and the perfect, the auxiliary for perfect tenses is verb to have. Again, just once you hear a simple tense, remember verb to do. While continuous tense, whatever past or present, remember verb to be, and perfect tense, verb to have. What are the auxiliaries of verb or verbs to do? We have do, does, and did. For the verb to be, is, am, are, was, were. Verb to have, we have, has, had. And of course, because continuous, remember this ing, and for perfect always comes with V3, the past participle form of the verb. And for passive form, again, V3. So in English, the V3 is linked to the perfect tenses and passive forms. So briefly, just to recap, simple equals verb to do, continuous equals verb to be plus ing, perfect tenses equals or equal verb to have plus v3, and passive form equals v3. Okay, this is the past tense, present, future. In OOT, we'll highlight on the first two tenses, present, past, and present. We have past simple, continuous past, and past perfect, and past perfect continuous. Again, present simple, present continuous, and present perfect, and present perfect continuous. As you see in simple, we see did, do, verb to do, and continuous was, am, verb to be, perfect had and have or has, verb to have, again perfect had, have. Let's take the first one, the past simple or simple past. I did my homework. This is the subject. Did, this is the main verb. Also, this is the auxiliary in the same sentence. So here we have do. This is the infinitive form of this past verb. And we don't have another main verb. So let's imagine that this sentence, like I took the medication. I took the medication, or I had the medication. Also past simple. So the main verb did or had or took, whatever, in the past form of the infinitive form of this verb. Actually, in English, you can see, or you can, again, you can say, I did take my medication or the medication. Also, I do like playing football. This is just to emphasize that you did, or you are really meaning the intended purpose of this sentence. But did or do in simple tenses are omitted. So that's why you just say, I had the medication, or I took the medication, without adding the verb to do. And we'll discuss this later in the next slide. And the second form, past continuous, I was doing. This is the subject, was, this is the auxiliary verb or past form of verb to be for the subject I, and doing, this is the do, the infinitive form of the verb, and ing, this is the continuous verb. Was because past, while am because present. So the continuous form in the past, I was doing, while in the present, I'm doing, because we are talking about present continuous tense. The third one, perfect simple in the past. As you remember that perfect equals verb to have plus v3. And because we are talking about a past tense, so we have to put verb to have in the past form. That's why we wrote had. I had done my homework. I, this is the subject, had the past form of verb to have and done V3 of do. My homework, this is the object. The same thing for present perfect. Perfect equals uh, verb to have plus V3. And because we are talking about present, we will put verb to have in its present form. And the present form of verb to have either have or has. And because I, this is the subject, we have to put have. I have had, I have done my homework. I, the subject, have the present form of verb to have for the subject I, and done V3, my homework, the object. The last one, and this is the most important one, past perfect continuous. And remember, for continuous, we have the first main verb, infinitive form of the verb plus ing. And the perfect V3, of course, verb to have whatever present or past. And in this last form, past or present, perfect continuous. So here we have two parts, perfect and continuous. Continuous equals infinitive form of the verb plus ing. So this is the first verb. And perfect V3 plus its verb to have, whatever present or past. So this is the second verb, V3. So how to form the perfect continuous tense in its past and present forms? Perfect equals verb to have plus V3. So had or have, this is the verb to have of the perfect compartment. Okay? And the rest here, V3 plus the above one infinitive form plus ing. How to write or to mention two verbs for this last form? That's why we wrote been. Been, this is the past participle of verb to be, because we are talking about a continuous verb. And also been or be, this is the carrier in English. You can carry out any part like ing, add the present past participle tense or form of this verb. So that's why we fixed this V3 form for each one of these forms. I had been, I have been. Been equals the first verb of the perfect part. Okay, so here we finished from the perfect part. Verb to have, had in the past form and have in the present or has. And the first verb, V3, been. And the last thing, the above one, the infinitive form of the verb plus ing. This is the infinitive form of the verb do, do, and ing, ing. So simply, the only difference here just have or had for the present and past. And we have learned how to, or the analysis of this tense. Again, just to recap the formula for each tense. The first one, past simple, subject, V2, the past form of the verb, and the object. While the present, again, subject, but here V1, the first form of the verb, not the infinitive. The infinitive, this is the source or the base of the word. While V1, this is the present form of the verb, and object, this is the third part of an independent sentence. Continuous, again the subject, was or were, because continuous equals verb to be, and the past form of verb to be was or were, depending on the subject, plus continuous, the infinitive form of the verb plus ing, and the last thing, the object. And the same thing for the present, but here the present form of the verb to be for the continuous tense, am, is, are. Again, the infinitive form of the verb plus ing plus the object. Perfect equals verb to have plus V3. Subject, verb to have, had, the past form of verb to have, and V3, object, again, subject, present form of verb to have or has, and V3, and the object. Perfect continuous. Perfect, this is the first part. Perfect. Had V3, had V3, because perfect. And continuous, V plus ing, this is the continuous. Perfect, continuous, and past, had. While present, have or has been, this is the perfect part in the present form, and VING, this is the continuous. So it's so simple and easy to know how to write any form or formula of each tense. Tenses in regards to time reference. The first tense, past simple past or past simple. This is the point of present. Let me change the color of the highlighter. This is the point of present, and this is the future, and this is the past. The first form, past simple, I ate. It's a past action or action happened in the past, and we can talk about a past habit or repeated action in the past using this tense. I played the violin when I was young. This is a repeated action in the past, and this is a simple action happened in the past and ended. I ate at lunchtime and finished. Or repeated actions in the past. This is the first one. The second one, continuous tense in the past. It's an ongoing past action if interrupted past simple follows. The first example, I was eating when she arrived. Again, this is the point of present, and this is the past. We can use the past continuous tense to talk about two events happened in the past. The first option, the first action or event happened firstly, earlier, and after that, another action happened to interrupt this first or this earlier event. Like this is the start of the earlier event, happened firstly, and was continuous in the past. Okay? And you can use another part to add another event happened also in the past, but it's of a shorter duration because the longer duration was eating, because this is the continuous one, longer duration but in the past. And the second event in past simple, because like it's on spot action, happened and ended. Or two actions, two events happened in the past and equals or parallel in their durations. I was writing while she was dictating. We have two events equal to each other, and both of them happened in the past and were continuous. So again, just to recap, the first usage for the first form of past, simple past, it's an event happened in the past and ended, or a habit repeated in the past. Like if you want to talk about a duration in the past or time in the past for this repeated action. The second one, continuous, it's an event happened in the past and was continuous in the past. And you have two options here. Either the first one is to talk about another event happened after to interrupt this continuous past action, or another parallel action to this continuous tense in the past. The third one, perfect, past perfect, I had eaten, completed past action before second past action. I had eaten before she arrived, or a duration of completed action, like I had waited for 2 hours before he arrived. So what's the difference between the first one or the second one, continuous, and perfect? And as you see here, also here we have two actions. The difference here, this event was continuous, was a, a longer duration in the past, while here it's on a spot, happened and finished, and again another event happened and ended. But the earlier one or the earliest should be written or must be written in past perfect, and the second one as the above example in simple. This is the most recent, and this is the earlier or the earliest. The earliest in past perfect, and the most recent, the most nearer, or the nearer for the present point in the past simple. So this is the difference between the above one and the past perfect. The last one, perfect continuous. I had been eating. Again, it's an interrupted, ongoing past action and another event, past simple, follows. I had been eating when she arrived. As you see, this example or this tense is very similar to the continuous one. I was eating when she arrived. I had been eating when she arrived. Also, this is an event of a longer duration, happened in the past, and another action interrupted this um this event, which is continuous or of a longer duration in the past, and the second event or this interrupting event should be written in past simple. So simply, again, the past simple on spot action happened in the past and finished. Continuous, an event was continuous in the past, or adding another event interrupting this first event but on spot, and the first one was continuous of a longer duration, or another parallel action. Perfect to describe uh, the relation between two events happened in spot in the past, and one happened before another. The earliest one must be written in the past perfect, had plus V3, and the most recent one in past simple. Like, I had eaten before she arrived. I had eaten, this is the first event happened. I ate firstly, then she arrived. This is the next action and written in past simple. The last one, again, two events, one of a longer duration, another one interrupting on spot action in the past, and the first one had been eating. This is the longer duration in the past, happened firstly, and again after that, another interrupting action happened on spot um, in the past simple tense. While the present form or present tense in simple form, I eat, like I eat salad every day, or the sun rises, or my plane lands at blah blah blah. The first usage is habit or repeated action, or for facts, or scheduled future event. Again, this is the point of present, and here the past, and this is the future. It's a habit, repeated action every day. So you have to use the simple present. Or fact, the sun rises also every day, and this is fact. We cannot change this action. That's why we always write this fact in a present or simple present. Or scheduled future event, like this one, my plan lands blah blah blah. The continuous one, action happening right now. I'm eating my lunch right now. at this time. This is a continuous action. We are talking about event happening now, or planned future action again. I'm going out tonight. So just remember the continuous present. This is an event happened right now, continuous right now. The third one, present perfect. Present perfect. It's a past action. Present past action. I have eaten squid twice, and for duration from past to now. So how we can use the present perfect tense for a past action? Okay, it's an event happened in the past and still relevant, or still has an effect till now. So that's why we used the present perfect to a past action happened in the past but still relevant or has effect. And for duration, again, this is a past action happened in the past and just finished now. Just finished now. Not continuous. No, it's just finished now. This is the another usage for the present perfect. So just to recap, present perfect, a past action happened in the past but still relevant, or a past action happened in the past and just finished now. Finished now. Okay, not continuous, because the continuous one, the last one. Present perfect continuous. It's an action started in the past, continuing to now. Started in the past, continuing to now. Till now, it's continuous. And the duration from past to now, like I have been working here for 3 years. That's why, that means I started my job or working at the point of 3 years ago, and I'm still working till now. This is the present perfect continuous. Okay, just to recap for each form of tense, the present simple, the subject I, we, you, they, and the infinitive form of the and the verb, simple verb. This is the V1 of the verb, the present form. While for subjects like he, she, it, we add the s, or exceptions for es or ies. We have exceptions for the usage of or adding this s to the verb. To form a negative sentence, here we used the verb to do, the omitted one above. But in the negative form, we have to put do or doesn't and did for the past one. Where is the past? Yes, did not. Simple, verb to do. Continuous, verb to be. Perfect, verb to have. Don't or doesn't, this is the negative. And again, for the usage of auxiliaries or how to form a question in English, we can take another session for the speaking subtest. But just to recap, the simple form, we use verb to do, do does for the present, did for past, and for the continuous we use verb to be, am is are for the present, and this is the continuous, am is are for the present, and was were for the past. Perfect equals verb to have plus v3. In the present, have or has for the present plus v3, and for the past one we used had. This is the past form of verb to have plus v3. And the last one, perfect continuous. Perfect, this is the first part, have or has plus been or had been for the past, plus continuous, verb plus ing, verb plus ing. Okay, Dr. Lauren Lulu, the second one, please. Can you speak? The third one, Dr. Maya or Maya. Um, Dr. Abir,
Yes, hello, Dr. Sam.
how are you, Dr. Abir?
Fine, thanks. Do you
Okay.
want me to read the
Yes.
what's written in the grammar?
Um, Regarding this example, I was smoking just when I had this dyspnea.
Yeah.
Could you tell me what's the tense of this example? The verb tense?
I was smoking just when I had this dyspnea. This is a past continuous.
Mhm. The past
Past
continuous.
continuous.
And here we have another event or another
This is
action.
simple. Yeah, this is action. The previous action, the first action was going on in the past, and
Uh-huh.
the second action happened
Yes,
late,
interrupted the first one.
interrupted the
So
first one.
that's why we wrote this
Past simple. We
tense
had
in the
past
past
simple.
simple. Yes.
Mm.
What about this example?
I have eaten a heavy meal. This is perfect. This is present perfect.
Yes,
Present
present
simple.
perfect. And what's the meaning of this sentence?
This means that I finish eating just now.
Yes,
Hmm?
or the event of eating this meal still has effect on me.
Or the verb still have the effect
Mhm.
till now.
Yes. The first example,
I take aspirin every day. This is habit, usual habit. So it is the present simple.
yes. What about this one?
Mrs. Lisa was drinking when she felt drowsy. This one also past continuous.
Mhm.
Was drinking, then interrupted by the second action, felt drowsy in the past simple.
Yes, great. And this one,
Mr. Smith has been referred to a patient.
Physiotherapy, physiotherapist. This is the
Physiotherapy. Yeah.
physiotherapist.
This one, perfect continuous has been, no, not perfect continuous.
Uh-huh.
This is
So
present
you
perfect.
analyze the sentence.
Has been referred. Present
Regarding
perfect.
Mr. Smith.
Hmm.
What's
Mr. Smith has been referred to a physiotherapy.
physiotherapist?
Has been referred.
Uh-huh. Okay. What's the verb tense or he for Mr. Smith?
Present perfect.
No, it's not complete. Your answer not complete.
Has been in a passive form.
Yes, in passive form.
Mm, yeah.
In passive form, always we will see this V3 verb. As you remember, the first slide for the verb tenses in this session regarding passive equals V3. And
Yeah.
that's why we got confused. You got confused regarding this V3
Mm,
has been referred. While
be-
has been, we always see been in the active form for the past and present perfect continuous. But here referred, not continuous. It's a past participle verb.
yeah.
So what's the tense here? Actually, the tense ends here. This is the tense.
Verb to be has been.
Has been,
Mm,
this is the present perfect. Has the present form of verb to have and been V3. So what's the tense with verb to have in present form and V3 present perfect?
perfect.
And referred V3, this is for the passive form. And Mr. Smith, the object,
Has been. Mm,
not the subject.
yeah.
Okay?
Mm, okay.
Thank you, Dr. Amir.
Welcome to Christmas.
Dr. Ala.
Hello, doctor.
Hello, Dr. Ala. How are you?
Fine, thank you.
Okay, Dr. Ala. Again, for the rest of examples here, this one, I
Mhm.
have been suffering from a right knee joint pain since blah blah blah. And sorry for the capital P here, should be in small.
The sentence in the tense of present perfect continuous tense.
Yes. And what's the meaning of this sentence?
Present perfect continuous. The suffering action start in the past and still continuous until now.
Yes. Thank you. And what about this example?
I am practicing exercise now. Present continuous tense.
Mhm.
Present continuous tense. It means that the action the action is continuing
Still
in the
happening
present
now or
happening now.
continuous now. Yes.
Yes.
This one.
Last night I vomited twice. It's a past simple tense.
Mhm.
It means that the vomiting action occurs in the past and ended in the past.
Yes, and we have no relation with the present
Yeah.
point now. This is
Yeah.
an event happened in spot in the past and ended or finished.
Yes. Yes.
What about this one?
I had noticed this bleeding before I had the medication. Um, I had noticed this bleeding before I had the medication. Uh, it is in this sentence in the past perfect tense. It means that uh, the action start in the past,
Mhm.
and the second action um, cut it in the past.
Not cut it.
Um,
Here, this is the difference between the past continuous and past perfect continuous with this tense, the past perfect. Past perfect means it's an action happened on spot in the past and finished, like the simple past, okay? But here
okay.
we have another event happened after.
Mm. Another event start after the first one ended.
Yes,
Mm.
okay?
Okay.
So this is
Okay.
the difference between the past perfect and past perfect continuous with the continuous past or past continuous.
Okay.
Because past continuous very similar to past perfect continuous.
Perfect continuous.
But
Mm.
perfect continuous alone without continuous, it's perfect continuous. It's past perfect like the simple past, but add to that another event happened.
Another. Mm. Okay.
Okay. And for this one,
I had been reading for at least a year before my sister learned to read. It is in the past perfect continuous tense.
mhm,
It means that the first action occurred in the past
mhm.
for a period of a time, then it ended, then the second action started after it.
Again, actually, the this event not ended at this
Mm-hmm.
point because I had been reading for at least a year before my sister learned to read.
To read.
Actually, the analysis for this example, this is the point of present,
Present. Mm.
and this is the start of the first event. My reading started at this point,
Okay.
okay, and
Okay.
was continuous.
Okay.
At least a year before my sister learned to read. My sister learned to read here.
Mm-hmm. The second action cut the first one.
Yes, but the first one was
Still.
continuous and this event interrupted it.
Okay.
But it ended in the past,
Mm.
but with a longer duration because it was continuous for a while. Okay.
Okay. Okay.
The last one.
We have been waiting for the test results for 3 days. Present perfect continuous tense. It um, it means that the action start in the past and still continued until now.
Mhm.
Test results for 3 days. Uh, and continued for a period of a time.
Yes, this
Uh,
action started 3 days ago, but still ongoing.
mm,
Okay, this is the present
okay,
perfect continuous. It's an event
continuous.
happened in the past, but still ongoing, still continuous till now.
Okay,
Okay, thank you, Doctor.
welcome. You are welcome.
Okay, this is the last slide for the grammar topic. This is the active and this is the passive. And passive equals V3. And as you remember in the previous slide, I said your verb tense in any passive sentence must end just before the main verb. Just before the main verb. What does this mean? For this example, present simple. The active form of the present simple tense for this sentence, they take the photos, they, the subject, take the main verb, the photos, the object. Actually, the value of writing a passive form sentence is to emphasize on the event or plus or minus the object, and here the subject not important to mention. That's why we removed the subject they, and we started our writing with the object, the photos. So the photos here, the object. And how to move this present simple tense for the passive form and express this tense with another words rather than the main verb. Why rather than a main verb? Because the main verb must be written in the V3 form always. Take, this is the main verb, directly convert the main verb for the V3 directly. Okay, how to write the tense mentioned in the active form in the passive tense or passive sentence without the main verb. Just write the auxiliary or the helping verb. The helping verb of its tense. Present simple for the photos, plural object, and present. Of course, you will not write where. Where, this is the past. That's why we wrote are. The photos are. The photos are alone. The photos, the object are. This is the present form of verb to be. And the present form means the simple present. So here, this is the tense of the original sentence, present simple, present simple. And the main verb always V3. Another example to clarify more, present continuous. The first step to convert an active voice to passive is to cancel the subject and start writing with the object, the photos, and directly take the main verb in the sentence and convert this main verb, whatever the form of this verb in the original sentence, to the V3 form taken. And what's the tense in the original sentence? Are taking, this is the present continuous. Are the present form of verb to be for a plural subject, they, because we used are, and take the infinitive form of the verb take, and ing, this is the continuous. Imagine that we took the main verb take, and the rest here are plus ing. Can you use aring? No, we can't. That's why we have to use the carrier in the English, which is verb to be, and put be here to be being. because the main verb take converted to taken v3. So the sentence will be like the photos are being taken. And again, the tense finished here. The photos are being blah blah blah. Just before the main verb, this is your tense. Are being, this is a present continuous, or the present form of verb to be for a plural object, the photos, while the photo is being taken. And be, this is the infinitive form of the verb be, the carrier, and ing to carry or to express this continuous present event. Okay. Dr. Dr. Anan, Dr. Anan, can you speak, please? The fourth one or the fifth one, Dr. Awais. Okay, Dr. Warda.
Yes, sir. Dr. West.
Awais. Again, your name, please.
Ji, sir. Yes, sir.
Excuse me. What's your name?
Uh, Sir, West.
Awais. Okay.
Yes, sir.
Okay, Dr. Awais. My question to you is how to turn this present perfect sentence in the active form to a passive form.
Mm, okay, sir. Sir, in passive form, the photos have been taken, and in active forms, they have been taken the photos.
Okay, and what's the steps to form this active sentence of voice to a passive? What's the steps? What are the steps?
Uh, Sir, actually, the nouns comes first. The
So
object will
talk,
come first.
talk
They,
about the original sentence.
sir, they will be replaced by the photos.
Yes,
Sir, they is
you
kind
have
of direct.
passive the subject. Okay, after that.
So we'll put the object photos.
Okay, write the photos instead the object. Okay.
Yes, sir. The photos have been taken. Sir, this is active is a kind of direct speech, and passive is a kind of indirect speech.
Mhm. So again, after writing the object, directly you have to convert the main verb in the original sentence to its third form taken. Okay,
Taken.
and
Yes,
cut
sir.
off here. Okay, so and let's go back again for the original tense in the active sentence. Have taken, this is a present perfect tense. And take, we removed take from the original sentence. Okay, how to express the rest of information for this present perfect tense in
They
the
have
passive form. Mhm.
sir, sorry, please repeat. They have the photos.
Mhm. So again, we need the carrier. Remember
Okay,
the
sir.
carrier here, verb to be. They have been, not they, the photos have been, because this is the carrier or the replacement of the main verb, which is taken. So have been, this is the tense of the original sentence. The photos have been, till now, have been, we have the present perfect, have the present form of verb to have, and been the V3 form. And taken, this is the main verb in V3 form for the passive voice.
Okay, sir.
Again, briefly for past simple again, please. So again, review the steps again for this example.
They took the photos. Will remove the. They took the- Sir, in this we have to remove took from the sentence.
Yes, but before that, remove the subject.
Okay, sir.
Remove the subject, they, and write the object
The pho-
instead. And after that, go for the main verb in the took or took. This is the past simple of take, took, take. So take the infinitive form of the main verb and turn it to the V3, taken.
Okay, sir. The photos were taken.
Uh-huh. And the rest of information here, the past tense of the main verb, because we removed the infinitive form alone and left the tense mentioned here, and the tense mentioned here is the past simple. So how to
Yes, sir.
express this past simple tense for the object which is plural?
Sir, for plural we use were. The photos were taken.
Yes, where? Because simply this is the past simple tense.
Yes,
And
sir.
what about the next one? Past continuous.
They were taking the photos, so we'll omit subject and use object. The photos were being taken. We use been over here.
Mhm. Again, being, be, this is the carrier for the ing and where the rest of information after taking the main verb take, and like this, remove the subject, remove the infinitive form of the main verb, and here the rest information, the object, where plus ing. We started
Okay, sir.
with the object, the photos, and turn the infinitive form of the main verb to the V3 and cut off here. So we have to mention words carry the same tense in the original sentence. We have where plus ing. That's why we added the carrier be to be were being. The
Okay,
photos were being taken.
taken. Okay, sir.
Is it clear? Okay. So this is your last example, please, for the past perfect.
So they had taken the photos. The photos had been taken.
Okay, and what's the analysis to convert the active to passive?
So we use been, P-E-E-N, had been taken.
What's the
So
first step? What's the first step to convert from active to passive? The first step.
sub, sub, sub with object instead of subject. The photos,
Remove the subject and write the object instead. So here, this is the
object.
object, the photos. Okay. And the next step,
We use had instead of taken. We remove taken and use been in it.
actually, we have to take only, not taken, because taken here equals take the infinitive form plus v3 form. Okay, and we will take the infinitive form alone and leave the v3. So here take and convert take again to the v3. So he this is the v3, the first v3, which is for the passive. And the rest of information here is had and v3, had and v3 without the main verb. And that's why we have to add the carrier be to the v3 form to be been. Had been. Okay.
Okay, sir.
The photos had been taken.
Taken.
Okay. Thank you, doctor.
Thank you, sir.
Okay, doctor, do you have any question regarding verb tenses?
No, thanks, doctor.
Okay, you are good, doctor. Okay, regarding this second part of our session, the writing correction, and the topic is an whole. Let me choose another participant to practice with me. Dr. Warda. Dr. Warda. Dr. Sobhi.
Excuse me. What's
Yes.
the meaning of V3?
Past participle.
Past participle form.
Yes.
Regarding the verb or
Yes, of course, for the verb.
okay. Thank you.
Yes, we are talking about verb tenses. V3.
Okay.
This is the past participle form.
Thank you.
You are welcome, Dr. Sobhi. Dr. Sobhi, could you practice with me for this writing task?
Okay.
Okay. So for the writing subtest in your exam, or the how to write a letter in the exam, what's the first step to write a letter? Dr. Sobhi?
Letter about what exactly? I have no idea.
So this is the first time for you joining?
Yes.
Yes. Okay.
Yes, the first time. Yes.
Okay. So excuse me, I will choose another participant just to.
Okay.
Yes. So Dr. Dr. Isra.
Yes, doctor.
How are
How
you?
are you?
I'm fine. Okay,
Fine.
so what's the first step to write a letter?
I will see the task.
Yes, I will start with
The
the writing task at the bottom of our task. This is the writing task.
here. Yes, here is the write a letter of referral for further investigation and definitive diagnosis to the gastroenterologist Dr. Jason Roberts at Newtown Hospital, 111 High Street, Newtown.
Okay, and after that,
I will see the last visit,
no,
the name of the patient.
no,
No.
yes, no,
Okay. Management plan.
no. You have to ask yourself two questions.
Yes, yes. If the patient, I know the patient, doctor know the patient or not.
Yes. So, does the recipient know the patient you are writing about or not? This is the first question. So, as you see in this writing task, does the recipient, who's Dr. Jason Roberts, know the patient?
No.
Is it mentioned here
Um,
any
no, no,
evidence guide you that the doctor knows the patient?
no. It's probably a GB referring a patient.
Yes, but simply here, Dr. Jason, there is no any information is telling you that this doctor, Dr. Jason Roberts, who is receiving your letter, is knowing your patient. The
Yes.
the second question is
The second question, I will see who the patient is.
yes. So, what's the name of your patient?
Um, Ms. Anne Hall
Ms. Anne Hall, and this is the date of birth.
of birth. Mm, okay. Then I will see. I will check for the last visit
And why you do that?
to see the purpose for the referral.
The purpose of referral and the main medical issue of this.
The middle, yes, the main complaint or medical issue.
Mhm. So this is the last visit. Okay.
Um, 18 of June 2018, presenting complaint dysphagia for solids, onset 2 weeks ago, post-viral infection, upper respiratory tract infection, self-medicated with over-the-counter Chinese herbal product, content unknown. No relapse or remittent course, no sensation of lump, no obvious anxiety, concomitant epigastric pain radiated to the back, level T12, weight loss 1 to 2 kilo, recent increase in coffee consumption, take aspirin occasionally 2 to 3 times per month, or no other non-steroidals. Provisional diagnosis gastroesophageal reflux plus or minus stricture. البلان refer to gastroenterologist for opinion and endoscopy if required decrease الcoffee and alcohol intake وسيز over the counter product وبantoprazole 40 milligram per day.
So what's the main medical issue for this patient?
To refer to gastroenterologist for further investigation and management and endoscopy if required.
Okay, but this is the request, not the main medical issue. I'm asking about the main.
I mean medical issue. Okay, dysphagia for solids.
Yes, the presenting complaint, dysphagia for solids. And the request here, or the purpose of your writing, is to
Mm,
refer to gastroenterologist for opinion and endoscopy if required. And
mm,
you have to advise your patient to decrease coffee consumption and alcohol intake and to stop over-the-counter product and prescribe pantoprazole 40 milligram daily.
Mm.
Okay, after that, what's the next step?
After that, I will mark the relevant or unrelevant information. I will
Yes. So we will start reading the writing task from the start
yes,
to select the relevant that information or relevant case notes and to cancel or omit the irrelevant case notes.
yes. Okay.
So, and actually you have to choose the relevant case notes in regards the first one, the main medical issue of this patient and the recipient of your writing or your letter. So you have to mention the relevant information to both of them, the case of your patient and the recipient. So let's start with the social history. دكتور إسراء?
BMI في الأول. Yes, BMI
Yes, okay.
relevant?
So the height, is it relevant?
No,
Weight,
no, not relevant. Not relevant.
weight, not relevant, which is
Yes,
BMI. Oh,
BMI is relevant.
yes. So mention that this patient is overweight at this date.
Okay.
Social
Social
history.
history.
Mhm.
Teacher, maybe semi-relevant. Teacher,
A
semi-relevant.
stressful job. It's a stressful job.
Okay, I
So
will mention it.
mhm.
Divorced, maybe.
Again, the stressful situation. Remember that the task provisional diagnosis gastroesophageal reflux.
Yes.
So this is in relation with the gastric acidity and in relation to stress.
Stress.
So
Okay.
that's why we will mention teacher, the occupation, stressful job, and divorced, also stressful situation. The patient is non-smoker.
I will choose social drinker is relevant.
Yes, social drinker. This is the positive information. And
Non-smoker will not be mentioned.
mhm. Substance intake null,
Okay, not relevant.
irrelevant. You will cancel this.
Okay, allergy codeine
Why codeine?
because it's ingested.
Yes, because this is the one we can take or digest or ingest. While dust mites, sulfur dioxide,
Respiratory maybe.
mhm. Family history.
Okay, family history. Father peptic ulcer. This is relevant. Otherwise, nothing relevant.
Yes, just take step by step. Mother, hypertension. Is it relevant to mention hypertension in
Not
regards the digestive system insult?
not
Irrelevant.
relevant.
Asthmatic.
Not relevant.
Father, peptic ulcer.
Yes, relevant.
So we have a positive family history of peptic ulcer. Maternal grandmother died heart attack aged 80.
Irrelevant.
Irrelevant. Maternal died asthma attack.
Irrelevant.
Paternal unknown.
Okay, irrelevant.
The last one
Irrelevant.
also irrelevant. Previous medical history.
Okay, childhood asthma is irrelevant. Chickenpox irrelevant. Measles irrelevant. Tonsillectomy irrelevant and very far past history. Hepatitis irrelevant. Subcutaneous cyst removed irrelevant. Whiplash injury irrelevant. Depression 2006 is very far, so maybe it is irrelevant. 2008 overweight without weight reduction, so weight reduction is irrelevant. Upper respiratory tract infection irrelevant. Dyspepsia is relevant.
Yes, relevant.
Okay, dermatitis prescribed oral and topical corticosteroid is relevant because the corticosteroid may cause gastritis.
Yes, this is the effect of the treatment of dermatitis, but dermatitis by itself irrelevant. But the treatment for this condition, this is the relevant case note. After that,
Okay,
the present.
last visit.
Mhm.
Okay. Uh, presenting complaint dysphagia for solid onset 2 weeks, post-viral upper respiratory tract, all relevant.
Yes.
Okay, self-medicated over-the-counter relevant.
Mhm. Contents and
course remittance the relevant.
yes, but here it's not important to mention that the contents unknown, just Chinese herbal product. The course no relapse or remittent course, is it relevant?
Remittent course is relevant. No relapse I will not mention.
Yes, okay.
No
But
sensation
here
of lump.
no relapse, no remittent course. Okay, so constant course, the progression
Okay.
or the progress for this condition is constant. Okay.
Okay. Okay. No sensation of lump, no obvious anxiety relevant.
Yes.
Concomitant epigastric pain refer to back level 12 weight loss relevant.
Yes, relevant. Recent increase in
Pain
coffee
is
consumption,
relevant.
again relevant. Takes aspirin occasionally
Increased
to
coffee
control
consumption is
asthma,
relevant.
again.
Relevant. We take aspirin. Relevant also.
Uh-huh. No other non-steroidal.
No other non-steroidal. I will not mention.
Yes, not important
Not
to mention
mentioned or
that.
not relevant.
And
Provisional diagnosis.
Mhm.
Provisional diagnosis gastroesophageal reflux plus or minus stricture relevant.
Yes. And this is our request is to refer to gastroenterologist, and we have to advise the
Decrease the
patient
coffee
to
and alcohol.
coffee consumption and alcohol intake and stop taking over-the-counter product and prescribe pantoprazole 40 milligram daily. So here we have revised the relevant case notes and cancelled the irrelevant ones. So this is a written letter from a colleague. And actually, I don't know the name of the writer. So Dr. Lorraine, good evening. I'm wondering if she still takes steroid for dermatitis long time ago. Do you consider it continuous or past because the word since have not mentioned? Okay. Dr. Lauren, actually, the answer for your question is to the importance for this point dermatitis in 2014 and had this medication, oral corticosteroid and topical corticosteroid, and the time gap here almost 4 years. We will mention this point not regarding the continuous taking or continuous action of taking this medication. No, this is the effect of this medication since this year, like it's a chronic peptic ulcer, whether this medication caused peptic ulcer, and this peptic ulcer is chronic peptic ulcer, so this will affect and like the adverse effect for or predisposing factor for gastroesophageal reflux. Okay, so this is the importance for this item. You are welcome, Dr. Ryan. Okay. Okay, regarding the letter format for this letter, on top, this is the date. Just remember. Okay, 18 June. 18 June 2018. And this is the address, Dr. Jason Roberts, and the specialty, gastroenterologist, Newtown Hospital, 111 High Street, and all capitalized. Newtown also capitalized. Dear Dr. Roberts, comma, and to review from the top, as you see, the date is written in British English format, and also Dear Dr. Roberts without period, also this is correct, title without period. After that, the subject regarding, but here you have to write the colon, a colon, regarding colon, Ms. Ann Hall, comma, 45 years of age or years old. And at the end, this is the closer, yours sincerely, again, a comma, because you wrote a comma above. So this is correct to mention a comma again for the closer. Yours sincerely, Y is capital, and your is having having the S. So yours, and sincerely, the second part in small, not capitalized, and leave a blank line, one or two blank lines, and then your sign off or signature like doctor, because your name hasn't been mentioned in the case notes. So just write your profession like doctor. So let's revise or correct the mistakes for your writing. I'm writing to refer Ms. Hall, who is diagnosed with gastroesophageal reflux and possible structure, full stop. She requires further investigations and management. Actually, the diagnosis for this condition of this patient, it's of course correct to write in passive form, but has been diagnosed, not is diagnosed, because it's an event already happened and still relevant, has been diagnosed, not is diagnosed. So here, has been instead of is, has been diagnosed with gastroesophageal reflux and possible structure. Actually, I saw lots of mistakes regarding the word possible and the noun after, even in the corrected modules or letters. So you have to add this up, because possible, this is an adjective for structure, the noun, and structure is countable, so you have to add up. She requires further investigation and management. The style of your requesting is informal, so it's better to write your further investigation and management would be highly appreciated. This is more polite, more formal. Dr. Idris, but she's not diagnosed yet. She is suspected to have it. Um, okay, this is a good point to discuss. If you want, if you can consider that, you can omit or cancel the whole sentence and to write whose signs and symptoms suggestive of gastroesophageal reflux and a possible structure. Okay. You can add provisionally diagnosed, who has been provisionally diagnosed, blah, 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 because it's mentioned in the writing task, provisional diagnosis gastroesophageal reflux. And that's why I accepted the idea of mentioning the diagnosis in the introduction. So you can add just the word provisionally. Today, Ms. Hall presented with the complaint of dysphagia while solids, and I couldn't read this word. If you can help me, solids, and I don't know this word, for the last 2 weeks. Today, Ms. Hall presented with the complaint. Actually, this is the first time you mention the hair complaint, and that's why you have to write a, not the. Presented with a complaint of dysphagia, while solids, what I can't understand your writing here, so I will cancel this word. And while also incorrect, 4. And the word for the last 2 weeks, you can change 4, because he like 4 solids 4, like over instead of 4. In addition, she is diagnosed with urinary tract infection, comma, for which she takes over-the-counter Chinese herbal product, period. In addition, actually, the chronology for your writing is incorrect, because you have to express that this condition started just after the occurrence for this condition, the urinary tract infection. So Ms. Hall presented with a complaint of dysphagia for solids over the last 2 weeks. Just after yes, just after he had she had urinary tract infection, for which she takes over-the-counter Chinese hair product, and in the writing task, self-indicated over-the-counter, contents unknown. Okay, we can change the verb tense for she takes, because as you see in the plan, you have to advise the patient to cut off taking over-the-counter product. So it's incorrect to still expressing that the patient is still taking the over-the-counter product till now. So for which she had an over-the-counter Chinese herbal product, or an over-the-counter product. So takes, you can turn takes to like had or took, and because also this is the first time you mention this product, over the counter product, and over the counter blah blah blah. During assessment, concomitant epigastric pain were noted, and it's radiating to her back at T12 level. It's more professional to write on examination instead during assessment. On examination, comma, a concomitant, no, without a, sorry, because pain uncountable. Right, to write concomitant epigastric pain was, not were, noted in its, and it's rotating, and it's here, it's contracted. So this is incorrect to contract in formal writing like OET. You have to write it is. And as we have another, the first clause, concomitant epigastric pain was noted. Here we have an independent sentence, so we can put a full stop to finish this part. But to continue with another section, here you have to put a comma, because here we have another independent clause, and it's radiating to her back at level blah blah blah. This is an independent clause with a complete idea. That's why we have to add this comma just before and. This is another word I can't read. Is it currently? I can't. Currently? Maybe currently. She is currently she is on aspirin 2 to 3 times per month. Full stop. Apart from this, she experienced loss of 1 to 2 kilograms body weight. Weight loss of 1 to 2 kilograms without mentioning body weight like this way. So can add weight loss of 1 to 2 kilograms. And actually you can add she has, because this is an event happened in the past but still irrelevant. Okay, just check that. Yeah, it's mentioned in the presenting complaint on today's visit, so still relevant. That's why we can use has experienced. Ms. Hall is a widow and has 2 children. This is irrelevant to mention. She is suffering from dyspepsia since 2012. Again, this is incorrect. Actually, it's an event happened in the past and ended. It's incorrect to mention the verb tense like continuous, present continuous. No, she had dyspepsia in 2012. She had dyspepsia in 2012 and is on overweight. Again, this is an incorrect structure. You have to say and she is above the normal range of BMI. It's incorrect to mention or forbidden in the OET to mention the expression overweight. Don't be judgmental. The sentence, she quit smoking since then children born. This is irrelevant to mention. However, drinks spirits socially. Okay. She has recently increased her coffee consumption, therefore instructed to reduce coffee and alcohol intake. Was instructed to reduce coffee and alcohol intake. And here we have to put a comma just after therefore, semicolon before and comma after, or you can end this first sentence with a full stop and start with a capitalized therefore, then comma. Yes, widow. Okay. Yes, this is right. Based on the above information, comma, it would and it capitalized should be in small. It would be greatly appreciated if you could confirm the definitive diagnosis of Ms. Hall and provide care accordingly. Full stop, consider endoscopy if required in hair treatment. Is it mentioned the endoscopy in the start? No? Okay, you can accept that. She has been commenced on pantoprazole and recommended to stop over-the-counter medications. Please note, comma, she is allergic to codeine. Actually, it's incorrect at all to mention a new information or new information in the conclusion. So this is incorrect. The conclusion should be brief and not including new information. So you can take the relevant information like the description of pantoprazole and the recommendation to stop over-the-counter medication or products, and the allergy and the positive family history of peptic ulcer just after this paragraph, to mention this information, and after that finish with the conclusion. Should you have any queries, please feel free to contact me. Yours sincerely, Doctor. The purpose, I didn't count the word actually. So let's start with the system criteria. The purpose 3/3. The purpose is clear and has the main medical issue plus the request. Content missed relevant case notes. Conciseness and clarity. Your writing is unclear, so you took 4/7. Genre and style, again 4/7. Organization and layout 5/7. Language 3 to 4. Yes. Overall C plus with 310 points. This is regarding this letter. Actually, this is the end of our session today. Do you have any question before we finish our meeting? Dr. Yasin, how can you express overweight above the normal BMI? Normal range of BMI. You are welcome, doctor. Okay, doctors. Actually, for this, we can take another session to talk about letter format again from the start, and I will share you a folder for this topic, letter format, and I explained everything in this folder. Okay, thank you, doctors. Okay, have a nice day. Have a nice day and good night. Okay, thank you. We can say she is obese. No, this is incorrect to say. You have to say just above the normal range BMI. Okay, doctors. Thank you and good luck.